And also they need help with accessing services and making sure that they help these service users link in with statutory services. And also their funding, they don't get much funding either. So there's an issue that they want to be recognised and get some access to funding to do this work as well. So that was one of the points. The other thing was training. The other point was training and awareness of mental health services to help communities know what's available. Some communities feel very much outside of our system and they want to get access to training and input from professionals or from people who can help them access what's available and where to go. And the last, no, there's two more points. One was are people, there was a question really, where people with long-term mental health issues who are stuck in the system, and are they part of this new framework? Because a lot of them feel quite stuck and not getting anything from services apart from feeling quite disenfranchised and stuck in the system. And the last one is access to services for minority cultural groups who don't have English as a first language, who require psychological therapies or psychotherapy. They can't get this through an interpreter, and so they wondered how that can be accessed using, I guess, people, psychologists or therapists who have that language as a fluent language as part of their repertoire. So those were the points that we gathered.
Perfect, and I've put them into the chat for you. So just before I hand back to Ray, because I'm really recognizing that it's 1 minute past 4, I just want to say a big thank you and lots of love to our facilitators who stepped forward and handled real challenges, because we had no idea how many numbers we were going to have. If you were briefing, if you were a facilitator, don't forget we've got the debrief next, because I want to make sure that we hear everything, how it went, and make sure that you go home feeling strong and supported. Thank you for John facilitating Chestnuts and having a face-to-face as well. You know, we just got to stick with the technology. That's what I say to people. It's always going to be a bit challenging, but actually what we get here is really amazing. So I just want to thank you for persevering with us. And I'm going to pass back to Ray so that he can explain what happens next.
I'm just going to hand back to Mehdi, but there was a comment in chat saying, will we be saving the comments in chat? Yes, absolutely. There's a lot of really, I couldn't keep up with all the comments. We'll collate them, we'll summarize them, and we'll check in with the facilitators, see that we have everything that you gave us, and collate it all, publish it on our websites and send it to you all so you can review. And then we'll try and somehow prioritize those and make sure they go to. But I'll hand over to Mehdi to close and sum up.
Thank you, Ray. I'll try to be very brief. I just wanted to, on behalf of Barnet Enfield and Haringey Mental Health Trust and Camden and Islington NHS Foundation Trust, I'd like to thank every single one of you who set your time aside to come and join us and making sure that actually you're shaping the future of community mental health services. And this is an important step for us, and it's not the last step. There will be a series of conversation with you either locally or perhaps wider sort of webinars, or perhaps in a face-to-face if infection prevention allows us. What we'll do is that we will record this. The recording of this will be on YouTube. As Ray mentioned and we earlier mentioned, all of your comments will form part of a Q&A in future, and they will be summarized on our websites, both in Camden and Islington and Barnet Enfield and Haringey Mental Health Trust. Please do visit our social media accounts on Twitter, Facebook, and elsewhere, and we'll post further updates over there for you to access any further information that you may require. Again, I really would love to thank you. I thought the time wasn't probably sufficient to hear everything, but we've got a lot to go back and then come back to you and refine those messages. And as I said, we will have the round of voting and we'll select the most popular ideas and we'll publish them to go forward and shape our services. Thank you and have a good evening.
So facilitators, go and have a break. Somebody wanted to know about being peers. So if you put your hand up and let me know who you are, I will sort that out for you and I'll see the...
Hi, it was Jess. Hi, I'm right here. Sorry, I was eating, so went off video.
Dee, do you want to put me and Jess into a breakout room?
Thank you.
Yes, I sent you my details. Do connect up with me. I'm happy to support you any way I can with this.
Thank you.
That was Varsha.
Mary Kate.
So I have one person in the conversation side panel who mentioned that.
Mary
Maybe it's
Kate.
working. I'll be there as soon as I can.
Sorry, has the event now finished?
Yes, thank you. Yes.
Oh, cheers, Ray. Sorry,
Thank you
I'm
very
stuck.
much.
Thank you. I wondered where everyone's still going on about. Thank you, Ray.
Yes.
Thanks for everything, Ray.
Thank you. See you.
Ray.
Thank you.
Ray.